When lives are on the line and every second counts, LifeFlight is called in to transport patients. But did you know that until recently, there was no way to give a life-saving blood transfusion on those flights? However, in tonight's Health Check, medical reporter Christy Myers tells us how a generous Houstonian has changed that.
Anyone who's been severely injured, who's faced death in an accident, knows that the sound of a LifeFlight helicopter nearby is an answer to prayer. LifeFlight now has a new high-tech fleet of 6 helicopters to transport the critically ill. And all 6 have a Doppler radar in a mini weather station, making landing safer. It has the latest medical equipment. But if you needed a life-saving blood transfusion, that it didn't have.
Well, the main issue has to do with money.
Dr. Red Duke, who created the LifeFlight program 3 decades ago, says they always wanted to carry blood on board.
That in these terrible injuries that have been occurring, that their survival is significantly improved by this early, intervention with blood products.
But blood products only last a short time, so it never happened. Then a severely injured patient, whose close friend was killed, asked one more time, why is no blood on board?
Nobody had blood on helicopters, even in Afghanistan and Vietnam, these other places. So the issue initially was some money.
That patient donated the money, $250,000 for freezers, refrigerators, and warning sensors. And now all LifeFlight helicopters carry blood all the time. They can quickly warm it.
They take the blood and they warm it through a little warmer that looks much like a flat iron, and then it goes right into the body.
They've given blood to 25 patients and counting.
But you're actually able to stop the bleeding.
How many lives will be saved? Trauma surgeon John Holcomb says they're studying that to find out.
What we're doing, obviously, is tracking that to see. It's our impression that it has really helped patients a lot.
And what they learn here is likely to become the norm for air ambulances in this country and the military. Christy Myers, 13, Health Check.
Well, here's another question Christy says many people ask, and that is, how do they know your blood type? Well, the truth is, they don't have to know it. They give O negative blood because anybody can safely receive it.